Hello, I'm Senator Ed Markey of Massachusetts, and thank you for providing me this opportunity to speak to all of you. And a special thank you to Operation Unite for the invitation to be here today. I would like to also take a quick second to thank everyone who has been working on the front lines of this critical issue. As you all know, the COVID-19 pandemic has exacerbated the ongoing opioid addiction and overdose crisis. The Centers for Disease Control and Prevention has noted that available data suggests an acceleration of overdose deaths during the COVID-19 pandemic. This comes after the United States saw the highest number of drug overdose deaths in our history in 2019. Individuals and populations who were already at greater risk of substance misuse or relapse into opioid use disorder have been placed into greater peril. As we all know, the pandemic has stressed every American, especially the most vulnerable Americans, people who are impoverished, people who are housing insecure, or who struggle with mental health. I want to work on this with you. I want to partner with you because we know that the pandemic exacerbates the opioid epidemic by further increasing barriers to treatment and isolating people from their support networks. The federal government has taken important steps to respond to this crisis. Last month, President Biden signed the American Rescue Plan into law, which provided $4 billion in funding to increase access to mental health and substance use disorder services, treatment, and prevention. $3.5 billion of this funding will go directly towards the block grant administered through the Substance Abuse and Mental Health Service Agency to address mental health and substance use disorders. In response to the pandemic, SAMHSA granted regulatory waivers to opioid treatment programs to help ensure patients can continue to receive treatments and new patients can be brought in. This regulatory relief has allowed individuals to be diagnosed with opioid use disorder and receive Suboxone treatment through telemedicine. However, we have to do more. The pandemic has shown us that we must increase support and expand these efforts. Addressing ongoing stigma is a key part of this discussion, which I know is the theme of your event this year. As you all know, stigma can lead to patients foregoing treatment, which in turn can lead to poor health outcomes. And I'm committed to working with you to ensure that we give everyone the help which they need. We must also find more ways to stop potential addiction before it takes hold, which is why I am currently working to reintroduce the Lessening Addiction by Enhancing label, or the Label Opioids Act, which would require opioid medications to contain a clear warning label about the potential of the drugs for dependence, addiction, or overdose. I am also working to reintroduce my Safer Prescribing or Controlled Substance Act, which will ensure medical providers receive proper training on the addictive qualities of opioid medications and pain management best practices. An unfortunate reality is that the closest many individuals ever come with substance use issues who get to treatment is through the involvement with the criminal justice system. And that is why a critical element of tackling the addiction crisis is about changing our approach to substance use issues within the criminal justice system. We need to do better. We can do better. And that is why I am also planning to reintroduce 3 bills aimed at improving access to healthcare for individuals involved with the criminal justice system. The first bill, the Equity in Pretrial Medicaid Coverage Act, would allow Medicaid benefits to be accessed by individuals who are in custody awaiting disposition of charges. Currently, individuals who have been arrested and are able to post bail maintain their Medicaid coverage, while those who cannot post bail can lose coverage despite not having been convicted of the crime for which they have been charged. This inequality in health coverage for pretrial detainee results in gaps of treatment, and it needs to end if we are to meaningfully address the opioid epidemic. I am also planning to reintroduce my Supporting Positive Outcomes After Release Act, legislation that would prohibit states from terminating an inmate's Medicaid coverage while they are incarcerated. This practice often prevents individuals from accessing treatment in the critical days and weeks after release. Under my legislation, states would be required to suspend rather than terminate Medicaid coverage, ensuring access to healthcare services more quickly after release from jail. Massachusetts is already doing this, and my legislation would ensure that every state will do it. We don't want people to leave prison and then do a U-turn and come right back because they don't have the coverage which gives them the services which they need. And finally, I plan on reintroducing my bipartisan legislation, the Community Reentry Through Addiction Treatment to Enhance Opportunities or Create Opportunities Act. This bill would create a new grant program within the Department of Justice specifically for local jails and state prisons to provide medication-assisted treatment. MAT has proven to be safe and effective at breaking the cycle of addiction and allowing individuals to lead productive lives. Evidence shows that providing MAT during incarceration can reduce the likelihood of an opioid overdose fatality. So in closing, the COVID-19 pandemic has highlighted the dire need for further innovation in our approach to substance use. And I believe your advocacy, your work has played a critical role in that equation. And I look forward to being your partner in tackling this issue moving forward. And that means ensuring that you have the resources to do the work you are already doing and to expand your efforts to rise to the challenge provided by the twin crises of opioid addiction and COVID-19. So I thank you all for listening and having me speak today. I want to work with you very closely. This is still a crisis in our country, and we have to provide the resources so that we're not incarcerating people, but we're medicating people, so that we're not stigmatizing people, but we're allowing them to be treated as though these are the diseases which they actually are. So I'm with you, I'm partnering with you, and thank you for everything that you do.